My name is Jürgen Gschwend. I'm urologist and chairman of the Department of Urology at the Technical University in Munich, Germany. So, depending on the IMvigor010 trial, the atezolizumab in the adjuvant setting was a negative trial, and therefore it was not approved. And therefore, I think it does not change by now. So we need more study results from the upcoming 011 study, the IMvigor011 study, which will probably change the scene. So these studies were quite different because one of the studies, both were randomized trials, but the first study was a randomized trial against placebo, and the other trial was a randomized trial against observation. And therefore there were some differences in the trials, also in the patient characteristics, and therefore it's hard to directly compare both studies. So it is definitely important to take ctDNA levels after surgery and then later on at different time points. So one single determination of ctDNA is definitely not enough, so we need it at different time points. So neoadjuvant chemotherapy was a part of the study protocol, but not all patients received neoadjuvant chemotherapy, and therefore there may be difference in the outcome after cystectomy in patients receiving or not receiving neoadjuvant chemotherapy. However, according to the study results, it's hard to do a readout regarding the positivity for ctDNA or being ctDNA negative or ctDNA positive, because patients that are ctDNA positive could have had neoadjuvant chemotherapy or not. So this is not really dependent on neoadjuvant chemotherapy. I think at this time there is no reason to change the guidelines according to the study results we saw, depending on the ctDNA results, since the IMvigor010 study was a clear study for adjuvant treatment of atezolizumab, and in the all-comer population this study was definitely a negative study because there was no difference regarding the primary endpoint disease-free survival. However, in a pre-specified subgroup of ctDNA positive patients, we saw a difference regarding disease-free survival and overall survival, favoring dosing with atezolizumab compared to observation. However, this is a hypothesis generating question, and therefore we need a follow-up study, which is the 011 study, and before we have the data from that study, it will not change the guidelines. So the IMvigor010 study was an all-comer study, meaning that all the patients in the atezolizumab arm received atezolizumab versus observation in the control arm. In the IMvigor011 study, we really testing patients after cystectomy for ctDNA positivity, and only the patients, the high-risk group that are ctDNA positive, these patients are randomized toward receiving atezolizumab or placebo. So it is a high-risk population, and therefore the readout of this study may be completely different from the all-comer IMvigor010 study. There's a big difference between both studies.